Hi, my name is Kimberly Harris, and I will be presenting Group Three's Affordable Care Act presentation. To begin, I'm going to simply just skim over the introduction. Within this introduction, it just talks about what the Affordable Care Act is and what the goal of the Affordable Care Act is. Also, within this subtopic, it covered those who were newly covered and the groups that were at the greater risk for lacking insurance. Um, as it's noted on this information slide, you see that young adults, minorities, and those with low incomes had made the greatest coverage change. And between the years of 2010 and 2014, the number of those uninsured dropped by 11 million. This was achieved through people earning less than the federal poverty levels and qualified to enroll in Medicaid. Also, individuals were able to remain on their parents' health insurance plans until age 26. People with pre-existing medical conditions who were previously denied coverage due to high costs of their medical expenses, and those who lost coverage due to loss or change in employment. So, within this HCA, there were some healthcare exchanges. And this subtopic briefly talks about the four different types of exchanges. You have exchange number one, which is state based marketplace, exchange number two, which is federally supported state based, exchange number three, which is state federal partnerships, and exchange number four, which is federally run exchanges. It is a important note that the federally run healthcare exchange offers the same private plan options as subsidies as state-run exchanges. Now, with these exchanges came with states being for or opposing. Um, the four different approaches that states took to implementing these exchanges were the early adopter states, and they implemented right away as soon as the ACA was passed. Then you had the pragmatic states who opposed of the ACA, but over the time ultimately implemented the state-based exchanges. And then you had the passive resistors who opposed of the ACA and did little or nothing to establish the healthcare exchanges. And then you just have active resistors who are just adamant in opposition to the ACA, don't do anything that would not implement state-based exchanges, even when as far as to turn down grant money from the federal for exchange planning. Further moving along, we hit the subtopic of Medicaid programs. So, what does the Medicaid program have to do with the ACA? One of the things the ACA likes to do is promote the program transparency about Medicaid um, policies and programs, including establishing meaningful opportunities for public involvement in the development of state and federal Medicaid waivers. It also likes to include provisions that are designed to increase program integrity in Medicaid, and these include terminating providers that have been terminated in other programs, suspending Medicaid payments based off fraudulent allegations and investigations, and preventing inappropriate payment claims under Medicaid. And these all fall under provider enrollment, pending investigations of credible allegations of fraud, recovery audit contractors, home health, and national correct coding initiative. And this slide basically talks about just the health insurance premiums and the ACA. This is just a brief definition of what health insurance premium is. And here's a sample of a health premium invoice looks like. So, how are premiums determined? There are 5 factors that determine premiums. We have age, which premiums can be higher for older people rather than the younger ones. geographic location, tobacco use, individual versus family enrollment, and plan category. Now, within this, there are 5 plan categories. They include bronze, silver, gold, platinum, and catastrophic. And here are just more information of how health insurance premiums are being affected by the ACA. With this slide, we're going to discuss political debate variables. One of the main debate variables is the increased cost due to expansion of healthcare coverage. Another one is physician defect and overworked providers. It says healthcare services as whole have only seen modest increase in demand. Current supplies of physician and healthcare workers have been sufficient, and there's a growing trend of role expansion for nurse practitioners and physician assistants. We have newly covered sicker than already insured. It's also noted that it is difficult to assess the cost and quality effects in such a short amount of time since implementation. The increase in access to healthcare, however, is measurable by the millions of newly insured Americans via health insurance exchanges, Medicaid expansions, and new business provisions. And in 2010, there has been more than 50 attempts to repeal the ACA, and all has been unsuccessful. So, what are some of the key challenges that state and national policymakers make in the ACA, or that is in regard to the ACA? Excuse me. One of them are Medicaid expansions. It's 4 million more Americans while healthcare coverage as states did not expand the state federal Medicaid programs to cover people with incomes at or slightly above the poverty line. And with this figure is just basically showing that that is true based off the previous slide. Enrollment, 18 million Americans who are eligible to buy insurance just refuse to enroll in the insurance. You have market stability. Those insurance that are for profit companies that have shareholders pull out of marketplaces altogether, and then those like Cigna express not wanting to expand its ACA business anymore. You have affordability, and then you just have political resistance. Um, we have major support from the Democrats in both the House of Representatives and the Senate, and for the American and for the Affordable Care Act, but those who are in the Senate and the House of Representatives of the Republican side are just completely opposed of it. Thus turns into replacing it with the American Health Care Act. So we have the American Health Care Act versus the Affordable Care Act. So what are some good laws for the American health care? Well, I'm just going to basically skim through this and gives a good overview of what laws that can be implemented that can make the Affordable Care Act even better than what it is today. With this, it says insurance companies cannot longer deny anyone coverage for pre-existing conditions. Businesses with more than 50 employees must offer health insurance. So, with that said, what does the ACA do right? Well, the payment system changes. They establish models that aim at paying for value and not volume. And these models are models such as Center for Medicare and Medicaid Innovation and Accountable Care Organizations. They have a public reporting of quality performance data. This allows the community to have access to comparative reports on individual physicians through the releasing of Medicaid data. And then you also have eliminating pre-existing conditions as a barrier to coverage. With support from the bipartisan, it allows individuals to purchase insurance even with pre-existing conditions and allows children to stay on their parents' insurance until the age of 26. Without risk pools, the uninsurable becomes expensive, causing premiums to increase. So, what are some provisions that can be taken away from the ACA? Well, one thing that can be taken away is decreases taxes on medical device companies and pharmaceutical sales to prevent costs from being passed down to consumers. It can include part-time workers in employer health insurance plans, and it can remove the 40% excise tax for insurance plans with annual premiums exceeding more than 10,000 for individuals or more than 27,000 for families. So, what are some ACA provisions to add? Well, the exchanges. Um, the cost driven by the risk of the insured, individuals could opt in or out of insurance coverage. So, option one is to continue current exchanges, but make the penalties closer equal to least expensive policy on the exchange cost. Option two, allow states to create and manage insurance exchanges and band together in regional pooling arrangements to cover the uninsured. Option three, Medicare for all, would be administered such as Medicare today will cover individuals that is not sponsored by employee healthcare insurance. We have Medicaid expansions. Get the 20 states to expand Medicaid so that 3 more million individuals will be able to get coverage. This allows CMS to provide block grants to states for Medicaid with the states taking control managing the population, but it will only work if states don't decrease eligibility requirements. And then imposing tax on industries that are harmful for our bodies, such as e-cigarettes, tobacco, alcohol, and weed. Studies have suggested that when you increase excess tax on these harmful substances, that means there will be a reduce of excessive drinking, smoking, eating, which will be more beneficial to our health in the long run. And last but not least, ramifications of repeal and replace. If the ACA was ever to be replaced or repealed, it would be devastating to the economy. One of the main things that will be in such a negative effect will be millions losing coverage. Thousands of people will no longer be able to obtain Medicaid coverage under law expansions, and people wouldn't be able to afford insurance without federal subsidies. People with pre-existing conditions can be denied. Excuse me. To stay afloat, insurers might have to quit providing insurance or raise premiums for many or all of people they insure. The Kaiser Family Foundation projected that if pre-existing condition provision is repealed, 52 million Americans could be at risk of being denied coverage in the future. And higher payments for Medicare 65 and up. This will restore higher payments for services performed under Medicare Advantage. This will lead to higher premiums for individuals for this managed service. Preventive services provided at free cost would raise premiums, out of pocket costs, or both. And with that said, this concludes the presentation. If we just take a look here, these are just a list of our references, just quickly skimming through each and every one of these topics of references that we use to conduct this presentation. I hope you guys enjoyed listening to this presentation. I hope that you guys took away some proper information about the Affordable Care Act. And with that said, I'm out. Thank you again and have a great evening. Thank you.